So again, welcome. Thank you guys for taking time out of your day to attend to learn about the changes to the SelectHealth plans. There are two plans we're going to be talking about today. We're going to talk about their zero premium essential plan and an enhanced option that is available for $19 a month. So you're going to have a copy of the slides for the essential plan, and then you will have the summary of benefits for the enhanced option. So my slide deck may be a little bit different because I added those enhanced plan features after the fact, after we printed. So I'll kind of navigate you as to which documents to reference. But before I get started, I do want to quickly announce some good news that is coming your way. The Medicare Part B premium has been announced for 2023 and is actually reducing. Woohoo! It usually goes up all the time, so it's going down. So January 1, it's going to go down to $164.90 per month. It's currently $170.10 a month for most people. High income earners will have to pay more, and we do have that breakout of what the income limits are and what your premium would be. If you think you're in that area, those handouts are over on the right-hand side of the tables, or for those who are joining us online, we will send those out to you digitally. We are waiting for the Social Security cost of living adjustment to be announced. That is also projected to be another increase, but we don't have a definitive percentage as to what that's going to look like. When we know, we'll let you know. But overall, we're seeing savings on that premium reduction, and then you guys are expected to get a Social Security bump. So overall, adds quite a bit back into your wallet, which is really nice. There are some handouts that we have at each station that I want to make sure you guys get a chance to look at. And again, for those who are attending virtually, we will send this to you digitally. There is a form called Medicare and All That Jazz. Great resources on here that we want to make sure you are utilizing. It does highlight the Medicare Part B premium, so you guys can keep that in mind. And then we also just reference again the websites that you guys could be using that would be helpful for you. We're encouraging everybody create a member portal or register online for the member portal with the insurance company, because there's a lot of tools and resources that are not being utilized that you have access at the touch of your fingertips. You can pull a digital copy of your ID card. You guys can look up in-network doctors. There's cost estimator tools. You can view your claims. There's all kinds of resources built into that member portal. And that's going to be at selecthealth.org, www.selecthealth.org. And if you need help registering, we can help you with that. You just need to call our office. Some big takeaways that I included on here that we're getting a lot of calls about. Medicare does not make outbound calls. Okay. A lot of people are calling our office. My phone is blowing up. Medicare keeps calling me. They want me to talk about my plan and new options. Medicare doesn't do that. Those are solicitations, and you have to be careful with what you're saying over the phone. We've had several people, without realizing it, agree to a plan change. I guess the way the questions were asked were a little misleading, and they ended up on a new plan. They took it as authorization to change their plan, and they did that over the phone, and it messed everything up. So don't do that. If you're not sure, take down what the phone number is that they called you in on. Let's say, hey, let me get back to you. We can look up that phone number and tell you if it's a solicitation. Also want to bring up another big thing. These commercials that are coming on with Captain Kirk and JJ Walker. So these are national commercials. Not all of those plans that they're advertising that are super spiffy looking are even available in the state of Idaho. These, again, are solicitations. We can help you if you are trying to get plan comparisons. Let us know what companies you're interested in, and we can double check that for you. But be mindful that those benefits that they're offering are not always specific to the state of Idaho. Okay? So make sure you're reading through those materials. I have a few extra details about what is the donut hole? How would it affect you if you're taking expensive medications or a lot of medications? If your medication costs are over $4,000 a year, you're going to be affected by the donut hole. So this explains what that means to you. The next infographic is ways to save on prescriptions. Now, the insurance companies do a great job with their benefits, but sometimes we find other prescription savings by using GoodRx, which is a free coupon service. Everybody who's attending today received a GoodRx card in their bag. I do recommend that you go online and you compare the prices because they do update frequently and they vary by pharmacy. So sometimes Fred Meyer is cheaper than Walgreens, and sometimes Save On is cheaper. So you want to check that every time before you get a refill. Other ways we can save, we look at patient assistance programs, manufacturer coupons. We also have a company here locally called Universal Prescription that is a free mail order service. They legally and safely are able to get medications from Canada, UK, New Zealand, outside manufacturers from the country. We just helped somebody not too long ago get a 3-month supply for the cost of 1 month here in the United States by using Universal Prescription. So sometimes we have to do a comparison. Sometimes your benefit through SelectHealth is going to be the best savings, and sometimes we have to look at outside resources to maximize your overall savings. And it could be a combination of using both benefits. And if you're not sure, please send us your drug list and we can do that comparison for you. We know that those can change throughout the year. So anytime you have a new drug or a change to a medication, you could reach out to our office and we can tell you where the best savings is going to be. Okay, any questions on the material so far? All right, well, let's go ahead and get started. For those who are joining us online, feel free to send any chat questions through and we'll stop the presentation to get those addressed. So I'm going to start with the essential plan, and then I'm going to show you what you can pay extra for if you want the enhanced version. So not every benefit that you see up on the screen is going to be a change. I am trying to refresh some of your memories on what the benefits are, because meeting with me one time a year does not mean you're going to have everything memorized and you're going to be an expert. So some of this is just a refresher, and then I'm going through the changes as well. So on the essential plan, there's no additional monthly premium. They're keeping it at 0. So everyone still has to pay the Medicare Part B premium, and that's either coming out of your Social Security check automatically, or if you're not drawing Social Security, it would be direct billed to you, or you're paying on Medicare.gov, depending on what your preferences are. So there's no additional charge for the plan. Everybody pays Part B, but the plan itself has no monthly cost. Maximum out of pocket. This is your stop loss for the year, the most you're going to spend in medical services in a calendar year. Prescription drugs are not included, but the medications you receive in a hospital or administered by a physician would be included in the maximum out of pocket. So this will include your inpatient services when you go to the hospital or a skilled nursing facility, inpatient rehab, and all your outpatient services. Max out of pocket reduces from $6,700 to $5,900. I can tell you, though, that the statistics the carriers give us about how much membership actually meets the max out of pocket is less than 3%. The copays on this plan are designed to be so low, it's going to take you a really long time to hit your max out of pocket. And you're going to see that reflected throughout the presentation. But just keep in mind, the most you spend in a year is now going to be $5,900 starting in January. So definitely not going to go medically bankrupt. I don't think you'll hit this, but it's there as your protection so you know the most that you're going to spend on your health care. Primary care visits. Can't emphasize enough how important it is to have a primary care doctor, a good primary care doctor that can help manage your medications and your everyday needs. No charge for office visits. Much easier usually with scheduling. Specialists right now, some specialists are well over 8 weeks to get into an appointment. So again, establishing a good relationship with your primary care doctor is going to save you money and should be easier to get in and get more face time with your doctor. If you see a specialist, they did reduce the copay dramatically from $50 to $20 an office visit. That's a pretty huge enhancement, especially for our clients that go regularly and have to do frequent follow-ups. But again, for all your little stuff, if you can run that through your primary care doctor, you will save. Overall, still a huge savings compared to 2022. Inpatient hospital stay. So this copay works a little uniquely compared to other benefits because it is an all-inclusive copay when you're admitted in the hospital. This per day copay kind of works like an all-inclusive resort you never want to stay at because that means you're sick or hurt. But it covers your room, your food, your surgery, your lab work, your imaging, your doctor consultations. They did have to do a slight bump to this benefit. Sometimes insurance companies, they're going to, not sometimes, but they do look at utilization overall, and they're going to take from areas that are not highly utilized, maybe do a little modification, like a small bump as we see here from 300 to 350 per day. And they're using that money to enhance other areas that have more demand. So in this case, it is a small bump up, but we also are reducing the number of days that you have to pay. So instead of paying for days 1 through 7, you are now going to pay for the first 5 days that you're in the hospital. So if we calculate that out, that's not even half your max out of pocket, which is really nice that an inpatient hospital stay isn't going to hit your max out of pocket automatically. And the average hospital stay is about 2 to 3 days, especially now that we're kind of in a COVID, post-COVID world. They want you out of that hospital as quickly as possible. All right, the enhanced option, just so you have a comparison. And remember, there's a summary of benefits at every table. It is $19 a month, same max out of pocket, same primary care visits are 0, but specialists are 10 instead of 20. And the inpatient hospital stay is 300 instead of 350 per day, but it is days 1 through 6 versus 1 through 5. So you are getting some enhancements under the enhanced benefit at $19 a month. You're going to see some lower copays in different areas. Okay. Going back to the essential 0 premium option, we did see a slight increase to the outpatient surgery copay. It went from $320 to $350, but they did that so they could reduce the ambulatory surgical center copay when you have a surgery at an ambulatory surgical center. So I want you to think of an ambulatory surgical center like Hollingshead Eye Center. They have an in-suite surgery unit for when you go and have your cataracts done or other services. They are not a hospital. They have their own in-suite surgery center. So it would be $250 versus $350 if you went to a St. Luke's hospital. Or like Treasure Valley Hospital. They only do outpatient procedures. They don't have an emergency room. They are not a hospital per se. They are an ambulatory surgical center. So if you can find a doctor that has privileges at an ambulatory surgical center and you find an in-network ambulatory surgical center, you will save $100 on a surgery. So it's a pretty good deal. And they're becoming more and more common. So if you need help with finding those, again, just let us know. We can run that by you, or ask your doctor if they have those privileges and if they could make the recommendation as to which facility they would like to use. Okay. Diagnostic colonoscopies. I like to talk about this one for a second because SelectHealth was very unique. They pioneered this benefit. If you go in for preventative colonoscopy, just your routine cancer screening, and a polyp is found, they're not going to charge you for removing that polyp under a preventative visit. If you schedule a diagnostic colonoscopy, which is, we know something's going on, and we need to investigate this further, so it's all about coding, very specific, then that's when you're going to have a $350 copay. Because they consider that like an outpatient surgery since you're put under and just the type of procedure, it matches the outpatient surgery copay. But again, if you're going in for a preventative colonoscopy and something is found, there's not going to be a charge. This is separate if you are looking for something specific or you have a history and they're coding it as a diagnostic colonoscopy. So you have to ask your doctor's office, is this preventive or is this diagnostic? Be specific when you schedule your appointment. I'm just scheduling my routine cancer screening. It's been 10 years and I'm ready for my next colonoscopy. Okay. Outpatient services in a treatment room was $50, like seeing a specialist and having a service done in their office was $50. It's now $20. And then wound care was $50. It is now also $20. So we are seeing some enhancements there. Moving on to the enhanced plan. The outpatient surgery copay at a hospital is $250. Ambulatory surgical center, I'm sorry, that should say $150. It's a savings of $100. I know the screen says $250. It should say $150 for ambulatory surgical. And that's because, again, you're paying $19 a month, so these will be reduced copays. Diagnostic colonoscopy instead of $350 is $250. And I just put this as a comparison because the wound care and all of that was the same. Diagnostic radiology, like MRIs, CT scans, and PET scans, which are really expensive, is a $50 savings compared to the essential plan. So it's $250 instead of $300. So you can see you're getting some value with that $19 monthly premium. You're paying extra to have lower copays. Going back to the essential plan, you do have worldwide emergency care with Medicare, with SelectHealth. So if you travel or are snowbirding in an area and you have an emergency room visit, those are going to be covered as if you're in network. So my little joke is no one cares where you go, just don't go toward the light. Insurance will pay for it. It is a $95 copay instead of a $90 copay. So always in an emergency, you are in network. You don't have to ask the question. Just go get the care that you need. Diagnostic tests and procedures. I like to use the example of a dermatologist doing a biopsy on a mole, just as a common example since it's such a generic term. That's going to reduce from 10 to 0 starting in January. Home-based sleep studies are reduced from $50 to $20. Lab work is going to go from 10 to 0, and outpatient x-rays are going to go from 20 to 0. A lot of enhancements have been made to this plan, so a lot of extra savings for you guys. Don't be afraid to use your benefits. On the enhanced plan, we still have the same emergency room copay at $95, but you are paying extra to have no charge for diagnostic tests and procedures. Both plans have no charge for lab work or x-rays. And then I wanted to add another perk that's not on the essential. They have $20 physical therapy copays versus $40 per visit, which can add up. A lot of times when I have a client that has a surgery, like a joint replacement, or maybe it's physical therapy to avoid a surgery, try and do some step therapy measures before doing the big, expensive, invasive surgery. A lot of doctors are prescribing multiple times a week for several weeks. So at $40 a pop, that adds up. So they've reduced that to $20 on the enhanced plan. That's what you're paying extra for. And then cardiac therapy is $0 instead of $10 each visit. Okay. We're doing things a little different in this presentation. We have collected common questions, service requests that our office has seen from our clients. So we're going to try and empower you with some best practices and make sure you guys are aware of some of these things. Who ultimately is responsible for verifying a doctor is in network? You are. It's not the bubblegum chewer at the front desk who takes the appointments and signs you in. You can't ask her, hey, do you take SelectHealth? Because she may not know that there are multiple plans that SelectHealth offers. They offer more than Medicare. They offer group coverage. They offer individual plans to those who are under 65. So are they actually verifying that your specific plan is in the network? No, not necessarily. So what do? You can call, text, email our office. You can live chat us through our website. You can call the carrier. Customer service is local. They're very easy to get in touch with. And again, the member portal. You can also download their app on your smartphone. It's just SelectHealth. And you can, at the push of a button, look up an in-network doctor or type in your doctor's name, and it'll tell you if they're in network and which facilities they're in network at. So sometimes you have a doctor that is in network at one location, but not another. You're responsible for verifying that. And if you're not sure, you reach out and let us know. We've had this question come up in previous presentations. Can I assume if my doctor was covered last year that my doctor is going to be covered this year? I would trust but verify. I would double check. There are so many contract changes that are happening. Independent doctors are now joining St. Luke's or leaving St. Luke's or joining another medical practice. You just have to double check. Let's just get that out of the way and verify that every year that your doctors are covered. Send us who you want to work with, and we can confirm and say, yep, these guys are covered. Go into 2023 with confidence. Okay. All right, let's talk about dental, because there's been some major enhancements on the essential plan for this. So essentially, you guys have $1,000 of dental coverage that can be used. That $1,000 does not apply to the preventative services next year. So that's really nice. You guys get the cleanings, exams, and x-rays without those charges taking away from your $1,000 benefit limit. I can't tell you every single dentist what they charge, but it's usually about $250 for cleanings and exams and the x-rays twice a year. So it's about $500 that's not coming out of your allowance, which is really nice. You actually have $1,000 to spend towards comprehensive services, which would be your fillings, your extractions, your crowns, your implants, your dentures, the big expensive stuff. They also got rid of the deductible that you had to pay. So if you went in for a service outside of cleaning, it was $50. They've taken that away. You don't have a deductible anymore. Woohoo! So we got additional savings. And if you go in for major services, the crowns, dentures, implants, instead of paying 60%, you're going to pay 20%, which is really nice. Oh, and let me not forget that you are also not going to have cost sharing for basic services like the fillings and extractions. Last year, you had to pay 50%. They're giving you a true $1,000 benefit towards comprehensive services. The only cost sharing you're going to have is towards the major stuff, the big expensive stuff, dentures, crowns, implants, and you're going to pay 20%. So great benefit to have embedded at no additional cost. I can tell you that dental plans, if you're looking for comprehensive coverage, like a standalone dental plan, probably starting around $45 a month per person. So to have this as a launching pad is great. I'm not saying it's going to cover all your dental needs. If you have 3 crowns and a bridge and a root canal, $1,000 isn't going to scratch the surface on that. You still may need an additional dental plan. Reach out to our office. Let us know what your treatment plan is. If you can get a treatment plan outline from your dentist of all the procedure codes they want to perform with what their pricing is, we can compare that against a standalone dental plan to see if it's even worthwhile to add a dental plan. Sometimes the cash price that the dentist gives you is better than dental coverage. So we can do that math puzzle for you and see if it makes sense to even add secondary coverage. If you were to buy a standalone dental plan, this plan would be primary. The one that's built into your plan, Medicare is always primary. So like I said, it's very situational. You just have to let us know what's going on and we can, again, do the math puzzle to see if it even makes sense. I know it's weird to hear an insurance lady say, hey, you may not need to buy extra coverage, but we have to crunch the numbers to verify that, okay? On the enhanced option, pretty much the same thing, except they're giving you $1,500 of dental towards comprehensive. So you get $500 extra dollars. For $19 a month, you're getting $500 extra a year in dental, along with the lower copays across the board. So that's the other appeal for the enhanced option if you think that's something you're going to utilize. All right, prescription drugs. Very happy with SelectHealth's prescription formulary. They're one of the few carriers that has always covered the shingles vaccination at no charge. Other carriers are finally getting onto that, but those vaccinations have been covered, thankfully. They're reducing the deductible from $150 to $100 for name brand and specialty drugs. They have a ton of medications. They've moved into the generic category, so you're paying lower copays. You can see the tier 2 standard generic meds have reduced from $15 to $6. They did do some bumps here on tier 3. It went up $2. Non-preferred drugs went up $5, and specialty drugs went up 1%. They had to do that to reduce that deductible. And again, because they moved so many medications into the generic class, it's really where they put the money, is to make sure that the everyday most commonly utilized medications were going to be super affordable and readily available. It's important to double check your prescription formulary or your prescription drug list every year because of all of the formulary changes that the carrier has made. A lot of asthma inhalers, COPD medications have been moved to a tier 1 copay, which is huge because asthma inhalers are very expensive. So please make sure if you are taking any of those medications, or if you know of anybody who's taking expensive inhalers, send those to us. Let us compare against this formulary, because we're finding that this has beaten out a lot of plans because how substantial those savings are. Okay? The enhanced plan is going to have no deductible. That's what you're getting extra for that $19 a month. Same copays for tier 1 and 2. Instead of $47 on preferred brand, it's $40. All other copays are the same except the specialty tier was $31 on essential and $33 with enhanced. But again, we're finding that these benefits are much richer and much more utilized. So the 2% bump here is really not that big of a deal. And we will get creative if we need to using those resources I mentioned on the handout. Vision services. So last year, SelectHealth had a vision plan where you can get a routine preventative eye exam for $50. It's now going to go to $0. You have to use the iMed network. They don't use VSP. This is called iMed. If you're not sure if your optometrist is in network, please let us know. You can still choose to go out of network, but your maximum reimbursement for that eye exam is going to be $35. So your money is going to be better, or not your money, but your allowance, if you will be better spent if you go in network, because you're not going to have a charge. The non-routine eye exam is $20 versus $50. So we saw a reduction there. And that's just, again, if you're needing, hey, I got something going on with my eye, I want something looked at outside of your annual wellness exam. Your vision test for your prescription lenses will remain at $0. So when they're testing your prescription strength to see if any tweaks need to be made, that's still no charge. And then they're giving you a $200 allowance every year as opposed to every other year. So now every year you can buy glasses or a set of frames or contacts if you choose. You can go out of network. Just remember your money's not going to go as far if you go out of network. So we want to try and stay in network as much as possible. On the enhanced option, everything's pretty much the same, except we see a lower non-routine vision eye exam at $10 versus, let me go back one, to $20. So you save about $10 on that. But other than that, the benefit is the same. Pop quiz time. We get this question a lot. How can I guarantee my claim is going to be paid? If you call our office and say you want X, Y, and Z procedure, we can tell you what the contract says your copay should be. But if you want to guarantee that you're not going to have a denied claim and that the insurance company is going to pay that claim, you want to ask your doctor to run a pre-authorization. That's going to have the procedure codes of what they want to do before they do it. And if the insurance company has any issue with the service or needs additional information, that's their chance to ask those details up front. And you will get something in writing from the insurance company with an approval or a denial. If there's a reason for denial, they include that, or they're required to include the reason for denial in all of their notices. A lot of times what we'll see is, hey, again, going back to surgery, did you guys try physical therapy? Did you try other things before you recommended this big expensive service? So that is just a fail-safe for you. Your doctor's office fills it out and sends it in, and then you'll get that information directly from the insurance company. So again, when in doubt, ask for a pre-authorization. Hearing benefit. We really like this. There's 2 buckets for hearing. You have medical conditions of the ear. You know, somebody could take an injury to the head and damage their eardrum. That would be a $20 copay versus a $50 copay. Matches the specialist visit, right? Isn't an ear, nose, throat specialist just like any other specialist? So it's going to go from 50 to 20. Routine hearing exams, just to check your hearing loss, see if you're a candidate for a hearing aid, is going to be $0. And then they have 5 different models for you to choose from. They vary in price and features. You do have to use St. Luke's Audiology or Elk's Audiology. You can't just go to any provider that you want to get these pricings. I don't have all of the differences between the budget, essential, and standard. That is really going to be a recommendation between your audiologist and yourself, depending on what your needs are, what features you're looking for. You know, some people want all the tech advances, so maybe they're going to look at the advanced or premium models, and some people just want, you know, a basic model, so they're gonna look at maybe the tier 1 or 2. We've had people compare this to Costco, and a lot of people are very happy with the savings and the different options that are available. So it's worth investigating and comparing at least against, you know, the standard Costco, or, I'm trying to think of what the other common one is that's around here locally. But anyway, we've had people spend a lot of money on hearing aids, so please take advantage of the potential savings that is built into the plan. They include the warranties, fittings, extra batteries, so you get extra by using this benefit. On the enhanced option, you're going to see a $10 copay for medical-related hearing exams, and then no charge also, again, for the routine hearing exams. The copays are the same for the hearing aids. You're really just saving on the specialist visit. Instead of it being 20, it's 10. These are not changes per se. These are extras that are built into the plan that we want to make sure you're utilizing. They have a St. Luke's Lifestyle Medicine program that helps you with managing, treating, preventing serious health conditions like diabetes, high blood pressure. So they have different classes, exercise, wellness courses that you can utilize at no additional charge. It's really just, again, trying to take a proactive approach to help prevent diabetes, high blood pressure, obesity, again, all these things that we tend to struggle with at some point or another in our life. And there's ways that people can help make it a little bit easier that are trained medical professionals that work within St. Luke's. So a lot of times people have to go seek out these counseling services and pay for them out of pocket, and SelectHealth is embedding this benefit for you at no additional cost. So if you get a new diagnosis and you're overwhelmed by how this can change your life and all the different lifestyle adjustments you have to make sure you're taking advantage of that program and get into some classes where somebody can hand walk you through what you can do and answer any specific questions. The other benefit that is not really utilized that I want to make sure you guys know about is the meal benefit after discharge. You have to be in the hospital for at least 24 hours to qualify, but they're going to help you get back on your feet by providing nutritious and delicious meals to your home, up to 2 weeks worth of meals. It's a quick call into customer service. You can call our office, just let us know when you are in the hospital, and then we reach out and we help get that set up. They will follow any dietary needs or restrictions that you or your doctors have. The goal is to support your recovery and make sure you're well taken care of, and part of that is your nutrition. The last thing they want after you have a surgery or a major emergency experience is going home, you don't feel good, don't really feel like cooking, and you want to call Domino's. Probably not best for your recovery to order Domino's or a Big Mac. So these are some healthier alternatives that are, again, included at no charge. Yes, these meals come from. You know, let me see if they have the vendor listed on here. Hang on one second. They use a vendor. It doesn't tell me exactly who is the vendor, but they have a company that they will use. The pre-authorization that's required is really just verifying your claim that you were in the hospital. That's the only prerequisite that you have to have, but they've tested out. They have a company that they will use, and they mail them to your home.
So that's different than Meals on Wheels.
Yes, it's not Meals on Wheels. It would be a different vendor, probably like Mom's Meals, but I'll have to verify and get back to you on that. Customer service is the one responsible for just approving it. And again, if you have dietary needs or restrictions, let's say you don't like spicy food, we can make sure that they don't include any spicy options. Or if you can't have salt, things like that. But they're supposed to be really good and better, a step up from a frozen dinner. They're still frozen, but just different than the ones that you get at the grocery store. All right. So the same benefit is on the enhanced option as well. There's no difference there. I just wanted to highlight that it's there for you at no charge. Some other improvements that we're really excited about is, and we want to make sure, again, you guys are using the Wellness Your Way reimbursement. So there's different healthy activities that you guys are already participating in that you can get reimbursed for. We'll give you some more information on that. You will be getting these details mailed to you. But another big thing that SelectHealth has added for 2023 is an over-the-counter benefit to help you spend money on your vitamins and supplements, your cold cough allergy remedies, your first aid supplies, your oral health care needs like toothbrushes, toothpaste. They've got all kinds of stuff. You're going to get a flex card that essentially you can take in store and you can swipe, and on the label, the price tag, like let's say you're at a Walgreens, it'll say OTC approved. So you know what items qualify. They have to be health related items. So not everything like a candy bar is going to be covered. But again, those wellness benefits are going to be included, and they're giving you $350 a year to spend. So that's pretty nice perk. They had up to $240 a year for reimbursement. Remember, that does include that gym membership. So if you're filing for a reimbursement, they'll reimburse you up to $20 a month. That's where that $240 was coming in from. But again, they're enhancing that to $350 next year, and you can now use that money if you want towards the over-the-counter items. Yes?
On that card, if you go to a health club, do they swipe that card, or how does that work?
Yeah, you'll want to take that card with you wherever you go. So it'll be in addition to your ID card. You'll, instead of filing for reimbursement, you'll just use that card. Yep. Good questions. Inpatient mental health services. This is if you're admitted into a mental health facility. I don't see a lot of utilization on this, but in case it does happen, we just want to let you know that it did change. It went from $260 per day for days 1 through 6 to $350 a day for days 1 through 5. So again, you're seeing an increase on the per day copay, but a reduction on the number of days that you have to spend. And then there's no charge for days 6 through 90. So you're just paying for the first 5 days. And because it's inpatient, it's going to cover, again, every bit of care while you're there, room, food, any medical procedures or tests that they're running or medications that they're providing. Pulmonary rehab, since we are living in a COVID world, post-COVID world, this has been a very big one. So it's going from a $30 copay per visit to a $20 copay so that you can afford to go more often, since it does add up each time you go. So that's a nice little reduction. On the enhanced option, you're going to get even more. Oh, I'm sorry.
Can you go back to the skilled nursing?
Skilled. Oh, I didn't mean to skip skilled nursing. I apologize. Thank you. Skilled nursing. Skilled nursing facility is when you don't need the hospital anymore, but you're not quite ready to go home yet. So I want you to think of an inpatient rehab facility. You're not going to pay anything for the first 20 days. In the 10 years I've been doing this, most of my clients have never gone past 20 days. I'm not saying it's impossible. I'm just saying I don't hear of it very often. So the rule of thumb is get better within the first 20 days and get home, because you're not going to pay for those first 20 days. After that, it is a little bit of a bump. So from $160 per day to $196 per day, just for days 21 through 55, starting in 2023. Again, because it's an inpatient service, it is an all-inclusive copay that covers everything that happens to you while you're in the facility. After days 55, you're going to have no charge for days 56 through 100. Medicare limits that the plan only covers 100 days on any Medicare Advantage plan or all plans, whether it's Medicare Advantage or Medicare Supplement, because if you're not better in 100 days, you probably don't need skilled nursing. You probably need long-term care. And sadly, they don't cover that service. So this is there to help you transition again from the hospital to home. It is not a permanent solution. It's supposed to be a temporary. But what we're seeing, even though it is a pretty big jump on a per day copay, it's a huge difference to pay for days 21 through 55 versus 21 through 75. So you see what I mean, where they'll take from one area to enhance another. Okay. So we still see that as a positive enhancement. So comparing to the enhanced option, you're going to get $550 a year in wellness benefits between over-the-counter and the gym membership reimbursement versus $350. So you're getting $200 extra. The inpatient mental health service is going to have a lower per day copay. Instead of $350 per day, it's $300 per day. But instead of paying for days 1 through 5, you pay days 1 through 6. Hopefully, again, you're in and out very quickly if you're using that, so you don't have to worry about the 6th day. And then the same exact benefit for skilled nursing, where we're paying for days 21 through 55 only, and it is also a $196 copay. Difference on the pulmonary rehab service was $20 on the essential. It's $0 on the enhanced. So again, you're getting some bang for your buck by paying $19 a month if you want the lower copays. Pop quiz time. Every year, especially when we send out our postcards and we say, these are all the meetings we're doing, people call in. How do I know I'm on the best plan? Which one should I be going to? So we put it out, some little highlights here on how you can verify you're on the best plan. 1, are your doctors covered? Probably not a good plan if your doctors aren't covered. So let's double check that. Are your medications covered? Remember, every insurance company has their own prescription formulary. What's covered on one plan may not be covered on another, or the same. You may have on one plan, even though you're taking a generic medication, they label it as a preferred brand drug with a higher copay and subject to a deductible. Whereas on another company, it's a generic drug at no charge or with no deductible. So very important to compare that. What services are you going to utilize the most? If I put all of the plans on a side-by-side comparison sheet, you're going to find something that's attractive from every plan. Somebody's going to have a lower copay in some area than another company. So again, this has to be on an individual basis. Your needs are different than your needs are different than your needs. So what may be best for you may not be best for another person. When we're comparing options, again, where are your most utilized services? Sometimes we look at all these benefits. You're not even going to use half of the benefits, but we're getting so caught up on the details, we forget we can prioritize our attention on what your specific needs are. Okay? Are you using all your benefits? Because every year I talk to people, they're not using that over-the-counter benefit. They forgot they had dental. They forgot they had vision, and they're paying out of pocket. So if you're not taking advantage of all of the savings, that's why we're kind of going through and refreshing your memory on some of these extras, because people are leaving them on the table and just spending money out of pocket, and then they think their plan's not working as well as it should be. But it's just, again, a re-education to make sure you know everything that's available and how to maximize your overall savings. Do you feel any cost burdens? Please vocalize that. Do you have a medication that's burning a hole in your wallet? Do you have a service that you're utilizing a lot that is just feeling really expensive? Let us know. Then we can, again, compare to other plans and see if there's a potential savings. Let me give you a quick example. We had a client who has cancer, going through radiation treatment. He was on a plan at 20% coinsurance every time he went. Very hard for me to quantify that to a dollar amount. I can only tell you it's 20%. But the feedback I got was, hey, is there anything we can do about my radiation? Because I'm getting killed. If I have to keep paying this, I'm probably not going to do radiation anymore. Oh, wow, that's a big deal. I looked at all the plans. I found a plan that had a flat copay of $65 each time he went. much more affordable. We were able to switch him over. He's happy. He saved a bunch of money. He was able to move forward with his treatment. So let me know, again, where your biggest cost expenditure is, and we can compare that to other options if need be. Sometimes you're on the best option. That's the only way we're going to know. So these are the defining factors and features that we want to focus our attention on. I also like to point out, a lot of people are very keen and focused on the extras that are built in on these plans, the dental, the vision, the hearing aids, and those are great features, but that should not be the defining decision. We want to make sure your medical needs are covered and you're protected in that way first before we worry about, is your dental going to be covered? Because we can add dental, we can always do that. But if we don't pick the right medical coverage, how much more are you spending? Or if you're going out of network and you're subject to all these expenses, remember, medical bankruptcy is the #1 cause for bankruptcy in the United States. So let's prioritize the medical portion. And if we can find a plan that has all those extras built in, because a lot of them have them built in, that's gravy on top. All right, moving on.
I just had one question.
Oh, yeah.
The medications, are they connected to an in-service doctor versus a in-service doctor?
Oh, not the cost of the drug, but I can tell you that if you're getting a medication prescribed by an out-of-network doctor, sometimes that pharmacy, what I've seen is the pharmacy won't fill that prescription. The doctor has to be in network. So there shouldn't be a reason you're getting medication from an out-of-network doctor, because there's so many providers that are in network, but it will not change the price of the drug. Like, I don't have an in-network copay versus an out-of-network copay. You just want to make sure, again, the doctor is in network, because sometimes they can't fill a prescription if the doctor's not contracted with the plan. Then they just can't even get that to go through. So I have seen that happen very, very rarely. And it's mostly for my out-of-state people where they have a medication from, let's say, a California doctor, since they're all moving here, right? And essentially the pharmacy here will not fill the prescription because it's from an out-of-state provider versus an in-state provider. So that's about the only time I really see an issue with that. But there is a difference, to that note, in price based on where you go, what pharmacy. So some pharmacies have preferred pricing and some have non-preferred pricing. So if you'd like us to verify that you are getting the best savings from a preferred pharmacy, you should also send us the name of your pharmacy as well, because that can definitely change the price. Yes, good question. All right, back to the essential plan. Foot care, podiatry services. Well, a podiatrist is a specialist. And remember, we already saw that copay went down. So this is reflected to show that as well. It's a $20 copay versus $50. And this is really highlighted, especially for people who are diabetic. They have to take really good care of their feet, or there's other medical conditions. I always like to point out as well, there's routine foot care that's included. You can see that it's for removal of corns, warts, calluses, trimming nails. Sometimes people have really thick nails and they're not able to, get a nice clean cut on that. And you can have a podiatrist cover that. I've had people ask if Medicare will pay for pedicures. I haven't convinced them of that yet. Sorry. The best we could do is having a podiatrist trim your nails. You're not going to get the massage and the lotions and the potions and all of that experience, but you will get a medical treatment to help with some of those costs. So it has to be through a podiatrist. If you go to a nail salon and go, oh, hey, Medicare is going to cover cutting the toenails or getting the calluses off, they don't have a way to bill SelectHealth. They wouldn't know what to do with your ID card. So please make sure you're using an in-network podiatrist. Durable medical equipment, some durable medical equipment, i.e. crutches, canes, and walkers, used to be 20%. They're now going to cover those at no charge to you, which is really awesome. Still have to pay for your CPAP machines. Sorry. Oxygen tanks, still got to pay for that. But they are upgrading where you don't have to pay for wheelchairs, walkers, canes, and crutches. That's a nice upgrade. Telehealth is also available for folks who may not need to go in person to visit with their specialist. Maybe it's just a verbal follow-up that's needed. If you want to save some gas, since gas prices are going up constantly, you can do that at a $20 copay. So they're going to just match the in-office copay. And since that reduced to 20, you're going to see that also reflected on the telehealth visit. So save yourself at least some gas money and go telehealth if you can. Comparing this to the enhanced plan, remember their specialist copay is 10 versus 20. So you're seeing that reflected on the podiatry services. They still have no charge for the crutches, canes, and walkers. And again, telehealth with a specialist is reflecting that $10 specialist copay. So you're getting some savings for paying $19 a month. Please take advantage of the Healthy Living Program. This is key. These rewards are going to be loaded onto your flexible benefits card, but you will get reimbursed $40 for your annual physical, which most people are getting. And if you're not getting that, please do, because we want to catch the small stuff while it's small. Breast cancer screening, $20. Colorectal cancer, which is your colonoscopies, $20. Annual flu shot, $20. Diabetic eye exam, another $20. Diabetes kidney disease monitoring, $20. And the health risk assessment is $20. So you can get up to, I think I calculated that as up to $160 of savings. And it's, again, loaded onto your flexible spending card that can be used towards gym or those over-the-counter benefits. It's a really nice perk. So they're already giving you $350. This is an extra $160 on top for things that you're already doing. And if you're not doing them, there's a financial incentive to do them. All right. So it's the exact same on the enhanced plan. There's no extra for paying the $19 because they already enhanced their benefit to $550 as a starting point. So it's still an extra $160 on these approved activities that will still be loaded on the flexible spending card. Okay, this is another big one that's very underutilized, and I want to make sure you guys know what's available to you. Virtual companionship. I mean, when you hear that, you're like, virtual companionship, what the heck is that? Doesn't sound like something I'm going to use. But here's why you want to consider it, because a lot of people are getting creative. They're using it for in-home health services as well. So you're going to get $30 a year. I'm sorry, $30, 30 hours. Thank you, Heather. Technology lessons, you could have them help you set up your SelectHealth member portal if you need help with that. We had a client who is a missionary and didn't know how to use a PowerPoint presentation, and she needed to create one for her mission work. And she had looked up what it was going to cost to pay for classes, and it was very expensive. So she's using this benefit to have somebody else build the PowerPoint for her, which is really cool. House tasks like laundry, light cleaning, organizing, and meal prep. So they're not going to clean your whole house for you, but they're willing to do some of that. That's a nice perk. I'm sure some of you could use that help. Or again, meal prep. That's a nice one. Not everybody likes to do all of that. Virtual and in-person companionship, kind of like the name of the benefit, kind of just, yeah, you get where I'm going with this. It's going to essentially be there for the people who have a hard time getting out of their house. They just want to have that extra friendship, companionship. So if you want to talk to somebody or make a new friend, you have that option. They can come in person or do it virtual. They can help run errands, and they can give you rides to your doctor's office or pharmacy. Again, another savings on gas prices. So it's like a transportation benefit without really being a transportation benefit. You would have to schedule that in advance. So it's not going to be like Uber where you can just call them up on demand. So again, make sure you're keeping those things in mind, and 30 hours a year, not dollars, 30 hours. On the enhanced option, you're getting 90. So triple. Trying to make that $19 worthwhile. I think you can see with a lot of the enhancements that are there and lower copays that you're definitely getting that benefit for the extra premium. Pop quiz. Everybody today has received their summary of benefits. If you're attending virtually, we're going to mail those out to you in your renewal packets. Please make sure you're reading through your summary of benefits. It is like reading a food menu for medical services. Oh, today I'm going to have a surgery. It's $250. Oh, today I'm going to have lab work. Oh, there's no charge. You'll know what it's going to cost you before you go. And it also helps you to make sure your bills are right. This is another cross-check. Hang on a second. My summary of benefits says I should only pay $200. How come I'm getting charged $300? Oh, that's a call to Shores Insurance. We can help you with that. The next part, your explanation of benefits. The insurance companies mail you an explanation of benefits. You can also go online through your member portal and pull down a digital copy much quicker than the snail mailed version. And that is a way to cross-check that the bill you received has been processed by insurance and the right benefits have been applied. What's very misleading is that you will get a bill from the doctor or the hospital that says right on the bill, insurance adjustment. People think, oh, that means my insurance paid. No, it doesn't. It actually is their guesstimate of what they think insurance is going to pay. And I can't tell you how many times we have a client that overpays on a bill and then has to fight for a refund. And it's an act of Congress. So they're quick to take your money, not so quick to give it back. How can we be more proactive? Read your explanation of benefits. Don't pay the bill till you receive the explanation of benefits. Verify that it was billed properly. Sometimes we've had clients see services that they did not receive that were on the bill. Let's hold the doctor's office accountable. Let's make sure it's correct before we pay the bill. And if you need help reading those, because I know they can be confusing, again, we're here to help. Sometimes when you log into your member portal, it can be a little confusing because you'll see 6 claims for the same date of service from the same doctor, and you'll see deny, 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 pending. What's going on there? A lot of times the doctor's office is getting denials because they didn't send complete information. They forgot to include chart notes. They forgot to include imaging records. They forgot something, or they didn't use the right coding. So it is possible that you could see multiple claims for one service that you had. And if you need help deciphering that or understanding what's going on, again, our office is available to help you with that. I can look at those things in 2 seconds. If you send me a bill that the doctor provided you and I am able to see your explanation of benefits, or if we're able to get into your portal to pull that down, we're able to put the pieces together of what the issue is very quickly. And again, we've got those pink boxing gloves in our closet to go beat anybody up if need be. So sometimes it is a coordination between the insurance company and that third-party billing company that the doctor's office is using. So 9 times out of 10, billing issues are a coding issue or missing supporting documentation from the doctor's office. The insurance company is a middleman. They can only pay on what they are billed. So if the bill isn't right and things aren't adding up and they can't justify the reason for paying this bill, they're going to send that back to the doctor's office. So we'll get a lot of people who call in, the insurance company is not paying. What did your doctor do or not do? Let's verify those details first before we start casting blame to the insurance company. Because like I said, 9 times out of 10, it's a simple admin issue. And it's not the doctor per se. It's, again, that third-party billing company that they're using. All right. Any questions at all about what we've covered? How about online? Anybody have any good questions for us? So far, so good? Okay, let me remind you of a few things. Annual enrollment does not officially start until October 15th. We were using this time because Medicare allows us as of October 1st to start sharing details to educate you on what is changing on your plan. How do you know if you want a plan change if you don't even know what's changing on your plan? So let's start with the basics. Let's make sure you understand how your current plan works and what's coming up next year. And then we can address those points that I talked about. Are my doctors covered? Are my meds covered? What services am I going to utilize? You have from October 15th through December 7th to make any plan changes that you want. You are automatically set to renew on your plan if you take no action. Please keep in mind, Medicare does not make outbound calls. Please keep in mind, you are going to be mailed a lot of information. Be careful what you send back, because sometimes people are sending information thinking they're requesting information and it's actually changing their plan. The last enrollment that is submitted on December 7th is the one that's going to go into effect January 1st. So you can change your mind as many times as you want up until December 7th. We have over here on these tables, sign-up sheets if you would like an in-person appointment or one-on-one appointment. If you would like to renew, please see Heather in the back. She will make sure that your information on file is correct, and we will mail that to you. If you're attending online and you'd like an appointment, please enter that into the chat, or if you'd like to renew, please indicate so. We can get those renewal packets out to you. Other than that, remember, our office is available as a resource. We want you to be proactive, not reactive. How can we prevent the headaches? Just call and ask. Trust but verify. And we're not going to believe, again, what the bubblegum chewers at the front desk say. We're going to verify with your insurance agent or the insurance company directly. So we've got a lot of good resources for you. Thank you guys so much for attending. Oh, yeah, one question.
To make sure our doctors and meds are in network, do we wait till October 15th?
No, I would send those now. Send
Okay,
those
so-
now.
So the information's out there for next year as far as in network.
Yep, we have the in-network information for doctors, facilities, pharmacies. We have the prescription formularies. Send those to our office now, and then we can get you a quick answer, same-day answer. Okay, we verified your doctors are covered. Here's your prescriptions, what you're going to be paying. If I find savings elsewhere using GoodRx or any of our other resources, we'll let you know that too. All right. Well, thank you guys again. I appreciate your time. I hope you guys found this to be informative. We're here to support you year round. We know health changes can occur at any time, so don't hesitate to lean on us for support. And we hope that 2023 is a great year. These are good benefits, so please use all of them. All right, guys. Thanks so much.
Thank you.